Welcome to Airway Exchange, the podcast for empowering educators and inspiring future CRNAs, a new series of Beyond the Mask supported by AANA.
We're your host team. I'm Greg Collins.
I'm Nickie D'Amico.
I'm Erin Martin.
And I'm Louisa Martin. We're here to support the community of CRNA educators with conversations to explore, learn, and grow.
To pursue excellence in the evolving field of nurse anesthesia education.
And to champion our students and enrich the future of the profession.
This is Airway Exchange. Welcome back to Airway Exchange. This is Nickie D'Amico, and I'm joined today by my co-host, Erin Martin. Good morning, Erin.
Good morning.
We are so excited to be here today and to have on our episode Dr. Gerard Hogan. Dr. Hogan is a teaching faculty at the Florida State University in Panama City. He is a 1992 graduate of the North Carolina Baptist Hospital School of Anesthesia, Wake Forest University. In addition to being a CRNA, Dr. Hogan is also a board-certified psychiatric mental health nurse practitioner and a retired U.S. Air Force Lieutenant Colonel who completed 2 tours of duty supporting Operation Enduring Freedom in Afghanistan. He maintains clinical practice at the Mayo Clinic in Jacksonville, Florida, and he is also currently, because he's not busy enough, a PhD student in the College of Nursing at FSU, where his research involves resilience and the use of mental health services in resident registered nurse anesthetists. He is past president of the Florida Association of Nurse Anesthesiology and currently a regional director for FAANA. Pretty busy guy. Thank you so much for being here with us today, Jerry. I know from your background, and we've worked together on the education committee in the past, about your background as a psychiatric mental health nurse practitioner, but I'd love to have you just tell us a little bit more about how you got interested in this area of scholarship and teaching.
So most of it was just noticing a difference since we moved to the clinical doctorate and the 36-month doctorate, noticing a difference in resilience in our students and noticing a kind of an uptick in issues and situations and problems. And it kind of made me think that, there's got to be some tie here. There's got to be something that we hadn't really thought about. And so that's what led me to my dissertation topic, which is looking at resilience in advanced practice graduate nursing students, because I wanted to include also those in other 36-month programs, other nurse practitioner programs, for example. That was pretty much what kind of got the whole ball rolling, and it's a whole discipline of science in an area that we're not really good at in nurse anesthesia. And I don't think that, because we kind of grow up in that mindset that asking for help is weakness. And the last thing in the world you can ever do is show weakness as a CRNA. I mean, I grew up in that, was trained in that mentality that, you only call in dead, you don't, you know what I mean? And it's like that you really have to show toughness, right? You're not allowed to show vulnerability. And then in a way, I think that's even more detrimental because they're afraid to come forward with issues or problems. And so I've been trying to set up an environment where they know they can come to me and talk to me about it. I tell them I can't be their therapist, right? That's not going to happen. I can refer them if need be. But I think that we need to refocus, since we've moved to the 36-month doctorate, I think we need to elevate our focus on mental health of our students and on the resilience in our students.
I think one of the other things that many of us grew up thinking, or historically we tended to think the culture perceived resilience as a trait. You needed to look for this on admissions because it was something that folks either had or they didn't have. And that is not exactly right. And I'd love it if you could talk just a little bit about the idea of resilience as a modifiable characteristic, something that we can cultivate and teach, and it is actionable.
Sure. So there are a lot of studies out there that show that you can actually teach resilience skills, and those usually come through things like teaching mindfulness training with students, teaching them to do their own cognitive behavioral therapy. I talk to students about that all the time. I'll say to them, especially if they're really stressed out, I say to them, what is the worst possible thing that could happen? And is that something that you think you can deal with and you can fix? And if they think about it and come up with something like, yeah, I think then sometimes that just kind of changes. So you can build resilience in people. Resilience is not about being unbreakable. It's about being able to bend and being able to adapt and to come back, basically. Stress is a signal. It's something that we all deal with. It's not a verdict on your ability to become a CRNA, and that's where I think that they get that mixed up. They think that because they're stressed out, that means I'm not going to be able to be a good CRNA, and that's just not true. These small, repeatable habits that you learn, those things can help you to be more adaptable, to be more mindful, and to find positive ways to deal with your stress. And so helping them with different ways to deal with their stress and to think of things from a different perspective sometimes, helps.
Maybe the perspective that, there are a lot of things that you can do. This is hopeful. This is not a situation where you should lose hope that you just can't do it. Just reframing for them and saying, okay, you've got this, and here's how. Here's some of the skills that you need to do this. I do think we probably, a lot of us throw the term resilience around, but don't necessarily have a good working definition of that. Maybe I should have backtracked a little bit and say, what is the definition that you use? So sort of the concept of resilience that you use, so we can then kind of break down, how do we as faculty begin to reinforce habits that build resilience?
So resilience is about adaptability. And because it's an ever-changing environment, the stakes are so much higher. Most of our students come out of an undergraduate program with zero experience in graduate school. They have no idea. And no one really properly prepares them for the difference between graduate education and undergraduate education. And so I think a lot of times knowledge is power, letting them know what they need to know to be successful, letting them know the ground rules right off the bat to be successful, and then helping them to understand how to self-reflect and to give themselves the grace to know that you can't be perfect, but you can keep striving. So for me, resilience is about adaptability, the ability to change with the environment and the situation that you're in. And so that's what most of them, we all have had those type A students that are so rigid, and they just have a really hard time with thinking differently. But, for the most part, it's a teachable trait. You can teach people to be more resilient if they learn how to deal positively with stress and have mindfulness, coping skills, that sort of stuff. That doesn't necessarily need a counseling center, although I refer students to the counseling center all the time if they need it. And I tell them it's not a sign of weakness to ask for help. And, a lot of times they think, I'm going to think less of them because of it, and so I think a lot of times they're worried about disappointing us. They're worried about the stigma that's involved with utilizing those services. And so, the ability to adapt and the ability to basically be fluid and move with the environment and deal with your own stress in a positive way, I think those are probably the highlights.
It's also a dynamic concept, right? So it's something that changes at different points in time. So one of our residents may demonstrate enormous resilience in one situation, but not necessarily in all situations. Would you agree?
I think that our job, a big part of our job, is to give them the tools that they need to be successful and to give them an understanding that you're not going to be perfect. And perfection is something that none of us have ever achieved, and that's okay. I still, to this day, when I work by myself, sometimes I'll turn around and look and I'm still at 8 or 9 liters of O2 and nothing else on because I forgot to, after induction, I forgot to, turn on I'm not perfect either. And I don't expect perfection from them. But what I want them to do is to understand the fact that they have to know themselves and they have to know their stressors and they have to know when enough's enough. Because, everything in life is dynamic. You could have a perfect day today and the next day find out that some loved one has a terminal illness or some other issue comes up. So those are those external factors that affect resilience. Then there's the internal factors, which are, just how wound up of a person are you to start with and what so there's both internal and external factors that affect it. So it is very dynamic. It changes all the time. And like you were saying earlier, there's no 36-month period in anybody's life that everything's going to be just perfect, So there are going to be times when things get very, very stressful and we need to be very cognizant and aware of that and to help them, not judge them.
So how do we do that, Jerry? I like what you said about I'm not your therapist. I can refer you, but I can't treat you. I think as nurse anesthesia faculty, we're all nurses, and I think it's sometimes hard for us to make that distinction that these are our students and not our patients, because I think we have a natural tendency to want to take care of and fix. So what are some things that we as faculty can do to help these students build their resiliency?
We talk a really good wellness game. And we've got a lot of wellness resources on our website. Mm-hmm. But a lot of programs don't really practice wellness, so to speak. And so I think that's a big part of it. I think that practicing wellness and helping them understand self-reflection, mindfulness, things that I work with our students on. Some of them, especially some of the male students, kind of roll their eyes at me like, but I try to get them to understand that there are definitely positive ways to deal with stress, and that asking for help is not a bad thing. The worst case scenario I can imagine is somebody doing something drastic.
Right.
Because they were afraid to talk to me about it.
Right.
I wanted to ask about when you say we talk a good game, but we don't always practice good habits with wellness. How important is it, do you think, for us as faculty to model good wellness habits? Is that a big part of it, or is it something different in terms of actions we are not taking to follow through on all the talk about wellness?
So I think that a lot of times faculty aren't really good at it either for themselves. We all have stressors in our faculty jobs that a lot of times you try not to carry that into the classroom. The worst thing you can do is be angry because you just had a horrible meeting with your dean and then go into the classroom and take it out on the students because they're a group of people that are vulnerable and easy to manipulate. The worst thing in the world to me are people who have to make people feel bad to make themselves feel good, right? And so what I do is I try to embed some resilience content into each class that I teach, and look at the resilience. There's a great number of resilience resources on the AANA website for students. Look at doing things with them, teaching them how to realize and to know when they're overstressed, know what their resources are, which I tell them, those are your fees, pay for those. You should take advantage of them if you need them, and just basically try to give them the opportunity to come and talk to me without judgment if there's an issue or a problem that they're facing or dealing with.
Kind of in that same vein of faculty not always modeling wellness the best, I think faculty resilience is something that may be lacking also. We're supposed to be the ones who are plowing through and constantly being the cheerleaders, but we know that faculty burnout is real. What are your thoughts on how we as faculty can continue to be resilient or build our resilience back?
Well, I think one of the problems that we have is that a bad habit that we carry forward with us is, and it's likely learned from being a nurse, is that we can always do more with less. And sometimes you just have to say, enough's enough. And a lot of times, I see places where programs work with bare bones minimum faculty, because the dean says we can't afford because you people are too expensive or whatever. You sometimes just have to say when enough's enough. And sometimes you have to learn to push back or step back, And I think a lot of times that we get into that catch-22 of worrying about if I leave, what's going to happen to the students, versus
the program.
If I continue, what's going to happen to my mental health. So a lot of times, just standing up for yourself and saying no. That's, to me, was one of the hardest things, is learning to say no. Obviously, from my CV, you can tell I can have a hard time saying no. But it's, that's, I guess, one of the hardest things to teach people is it's okay to say no.
Yeah.
Are there any traits that we could look for in those who are starting our programs, or is it something that we really have to just, deal with it once they get there and then work to build it and grow it once and foster improvement?
I'm not a huge fan of emotional intelligence quizzes and tests, because the people that apply to our program aren't very intelligent people, and they can very easily tell what answers we want to hear versus what the truth is.
And we're seeing a lot of that, an increasing amount of that, where folks are, if you will, trying to be the person they think we want them to be.
Right.
Authenticity in applicant assessment is becoming difficult.
I can tell you a big part of it is during the interview process is them knowing the difference between a reason and an excuse. And what I mean by that is a lot of times during the interview process, I'll question them on the C they got in chemistry lab or whatever. When they say, it was my fault, I was 18 years old, I lost track of the reason why I was at college because I was having too much fun or whatever, they're taking ownership. If it's, well, my dog had parvo and the grass was dead in my front yard and those are excuses, right? And so a lot of times I think people that really understand the difference between a reason and an excuse have a tendency to also be people who have the ability to understand how to deal with their stress better and how to, where I think there's a correlation there. I'm not sure. Probably that's yet another study that I guess that can be done. I just find that during the interview, a lot of times you can tell people that are, and sometimes I joke and say that I'm a terrible judge of character because I always admit somebody that I'm like, why, a year into it, I'm like, what was I thinking?
We all question ourselves.
Yeah.
Mm-hmm. We've talked about that on this podcast as well. So yeah, it's a challenge for all of us. Yeah. And then, you're in the business of researching this topic. Do you use any formal tools to assess resilience, assess change over time on a routine basis? Is that something you're just doing for part of your research? I presume you are doing that as part of your research.
There's a couple. There's a Connor Davidson resiliency scale that's available, that's out on the market. There's a resilience scale for adults, which is also available, and that one's free. You can use that one for free. There are actually ways to periodically assess wellness, resilience in your students. In my dissertation, what I'm looking at is using the resilience scale for adults, and then there's a scale for help seeking, how open they are to help seeking. Because my thing is that I want to see, number one, where they feel like they are resilience-wise, and number two, are they willing to ask for help if they need it? Those are basically two of the biggest questions that come to mind. And my chair is, she's like, okay, well, this may be your life's work, but it's not going to be, we're not going to do this for years. We're going to do whatever. We're going to do one piece of this, and then after you graduate, you can do all you want. But we're just doing the resilience part right now. But so look at some of that stuff, because, Tony Chippis looked at that years ago. There is really no solid study that was done that looked at like nurse anesthesia students across the country at the master's level. So there's really no data to compare to because it just didn't exist. Now, there were some smaller studies that were done at individual programs, and there have been people, Jackie Mainwaring and Masiska, I can't remember, I'm sorry, I can't think of her first name, did an article that was really, really a great article. It was in the ANA Journal where they looked at the stress level and resilience in their own cohorts of students. So the single cohort studies, they're out there, right? But there's nobody that's really looked at it kind of across programs, which is my goal. My end is 600 students. And so that's why my shameless plug to program directors is that when you get my email that asks you to share the link for my survey to your students, please do. Because I think this is valuable information that we all could benefit from knowing, I don't think it's something that we think about a lot, but I think it's much more worrisome to them than it is to us. The issues that they're having. So I think that we could just be better at recognizing and helping, because again, like I said, you don't ever want to get into that worst case scenario where something drastic happens.
Oh, correct. Yes. And I echo your plug, because I think it's important for us to support other nurse anesthesiology researchers, and in addition, this is very useful information for us at our own programs. You said something that I really want to circle back to, and that is part of the assessment is asking the person to reflect on their own resilience. How resilient are you? Do you have strong resilience or not? Are we good at doing that, or do we stink at it?
I don't think it's something that's like an interview question that anybody asks. I think they're more worried about whether or not they can, give them a blood gas and vent settings and have them change, more clinically focused things. I like to try to get in their head, but that's just me. I ask them, for example, like, if you don't get in, what are you going to do? And, of course, we all know what the answer we want to hear is I'll reapply or I'll apply somewhere else or whatever. So motivation, I think, is a big part of it, because motivation actually has some effect on resilience. The more motivated they are to complete the program, the better they are at self-realizing and self-help, to get through it. So motivation is important. It's a big part of it. And, it's not the easiest thing in the world to figure out, what their motivations are. But, I think that there's some things that just their basic demeanor and how they, and there would be nothing wrong with asking them questions about resilience.
I guess I'm curious, if you were to ask someone, are you a very resilient person? Rate your resilience on a scale of 0 to 10, and then you do an actual assessment using a validated tool of their resilience. Do they tend to line up pretty well? Are they coupled, or do they generally think, oh no, I'm very resilient? Most people think they're probably, I'm tough. We have different conceptions of what it is and whether or not we have the grit or toughness or resilience.
Again, I worry about the bias of them worrying that if they tell the truth, it's going to affect whether or not they get in. I think that they're much more likely to be honest once they're already in about it. At least that's my hope, that they're willing to be honest on it, on the resilience scale, and see where they fall. And, you can do that in individual programs. You can have them periodically there's a brief resilience scale that's only 10 questions that they can take just to see where they're at and to see whether or not it's something that you need to address. We've kind of gone back and forth about what exactly we're looking at as far as students are concerned. And, my chair felt like the 0 to 12 month was pretty early still in the program. And the 24 to 36 month group was kind of, they were seeing the light at the end of the tunnel, maybe. So probably the middle group would be the best to assess. But it's something that should be assessed all the way across, because, especially in front-loaded programs, because a lot of students, they get through the coursework and then they don't realize just how stressful clinical is. Mm-hmm. We were evaluated every day when we were students, that daily evaluation grind, the hours, the expectations, all those things just sort of additive kind of the stress, and it really starts to pick away at people's resilience. And I think that's something that we need to take into consideration too. And it's funny because across programs, I notice, especially when I go to other programs and stuff like that, there are actually programs that have wellness days that mm-hmm. students can take a day if they need a day kind of situations. There are other ones where you get 2 weeks of vacation period a year and don't ask for anything else. So I think that across the board, I think we could be a little better about understanding and realizing the fact that sometimes adults need to step away for a minute. And if that means a day, that's okay. Even as CRNAs, sometimes I think we're really guilty of pushing ourselves too hard. How many times have you heard of people that have had some unexpected, horrible, terrible outcome, and then they're just expected to just pull it together and move on and do the next case, mm-hmm. right? Then you don't get a chance to, recover from that. So I think that we could probably do better for ourselves as well. But, that's a whole nother topic.
It's a whole nother dissertation.
Yeah.
What have you seen integrated into curriculum at other programs or your own program? Are there particular strategies, or again, does this have to be a standalone course? You mentioned you try to include some touch point with resilience and fostering and promoting resilience in every class meeting. Are there recognized or, sort of repeatable strategies that we could use across programs, in your opinion? Are there things we could do?
So you could, if you're a face-to-face course or even on a Zoom course, you can start or end class with a 2 to 3 minute grounding exercise, whether that be like paced breathing or brief body scan, just to see where you feel and what you're feeling. 5 senses check, they call, is one thing that you can do. That's tied explicitly to kind of their where they're at the moment, right? And they can also, you could tie it into anything from performance anxiety to patient safety to any number of things, A lot of times I just tell them, like, we've all been with students in clinical where things just aren't going real well sometimes. And I just will tell them, okay, stop, take a deep breath. And especially if you ask them a question and they can't answer your question. And then they start getting frustrated and okay, I try to be very Socratic. I try to give them throw them a bone, okay, well, think about this and try to lead them towards the answer. But a lot of times, that's high stakes, and then, look at all the things we've added on to this. We've added this, so many programs now with these minimum C scores to graduate and, and a lot of these other hurdles that we've added, even just since I was a student. I think that it's unintended, but I think that we just stress them out a lot more than, so you could do written reflections. Yeah, it's a little bit more work. Someone has to read it. Stress temperature checks, polls. You can, especially before big exams or like high stakes activities. So there are a lot of things that you can build into your class that can help, a lot of times especially before exams, have them, okay, everybody sit for a minute, close your eyes. Imagine being on a beach. I'll do that with them, take a deep breath. We're gonna do this. It's gonna be great. You're gonna do fine. So they love positive affirmation too. They like to hear when they're doing well. And unfortunately, I think a lot of times we focus on the negative and not as much on the positive. I had a student tell me one time she was their keynote speaker at graduation for the class, and in her speech she said, "And I want to thank Dr. Hogan because he's the only person here that ever told us he was proud of us." And you never think to yourself that words like that matter, but they do. They like positive affirmations. So I tell them all the time, especially the ones that I work with on their doctoral projects. I tell them all the time, I'm proud of you guys. You're doing a great job, whatever. Because I think that they just need to hear that effort is paying off and that they're doing, and I think that as educators, I don't think we're really good at that.
Switching the mindset to celebrating the effort and the waypoints along the way. It's huge. You're presenting this. I took a peek at your slides and it talked a little bit, and I think it really touches with what you're talking about here is that there is this hidden curriculum, and sometimes just putting some sunlight on that. Things like the competition's over. Folks, we're not competing with one another. You don't have to be perfect. Some of those things. I think just putting that out there is incredibly powerful, just reminding them periodically about those misconceptions.
If it were up to me, I would get rid of and probably getting a hate email for this one, but I'd get rid of the Agatha Hodgins Award. I'd get rid of all that stuff because you know what? It's not a competition. Mm-hmm. It's not, and I don't want people thinking that they have to do something, above and beyond their stress level or ability to cope in order to win a prize. There's no prize involved in this. And that's what I tell, them at the beginning is I say, you're here because you can do this. And my goal is that if 24 start, 24 finish. That's the goal. So there's because we all deal with students that they're kind of paranoid. They're like, they get this like feeling like we're out to get them sometimes. And I tell them all the time, listen, you're wasting a lot of time and energy worried about me worrying about what I'm going to, I got so much more on my plate. The last thing in the world I'm doing is sitting up at night scheming what I'm going to do to you,
Do you know how much work that is for me? Yeah.
So, it's like, take a deep breath. It's okay. We're going to get through this, and unfortunately not everybody does. And that's okay too. But, and that's the other piece of it too. What adds to a lot of their stress is the fact that, you ask them to quit their job. You ask them to take out loans, you bring them into class. They've made a lot of sacrifices. Even if they left, they're not going back to that job after they basically pieced out to everybody there. I'm going to anesthesia school. I will see you later kind of, and, so they make a lot of sacrifices too. And I think that sometimes we don't really keep track of the fact that they're making huge sacrifices too to be there. So it's a two-way street.
We often have to talk with them about, no one is more invested in you finishing the. I want more than you possibly know for you to get across the finish line. There's no one wins if that doesn't happen. And we have to accept it sometimes, but it definitely is something we have to keep reminding them. No, we want you to succeed. All right. Any other pieces, questions, things you wanted to talk about that we haven't gotten to?
I guess when you talk about like resilience theory, you're kind of talking about looking at things from kind of a strengths and weakness based lens, and you're looking to try to mitigate that and figure out that dance between the stressors, the supports, outcomes, those things. We know that resilience isn't fixed, and we know that students can have a direct effect on the positive side of resilience, that they can work. You can help them to work for it because it's such a dynamic process to start with. The external and internal factors make a big difference. The ability for them to know they can come talk to you about anything, and that's my big thing with them is, I tell people that if your students are afraid to come talk to you, it's you. It's not them. So if that's a problem, then that's something you need to work on, not something that they need to work on. Well, they never came to me. They never told me. Well, why? Why don't they want to talk to you? Because we can intentionally cultivate better resilience and better coping in our students based on how we act as faculty and about how we are willing to talk to them. I tell them, they come in and talk to me about anything. I might not have an answer. Sometimes they just need to talk. Sometimes they just need to kind of vent. Fine. Come talk to me. Sit in my office. Vent if it makes you feel better. I think that we just need to be better about understanding the fact that, like I said, in that 36-month block of time, things are going to change. Things are going to happen. These are adults with adult problems. They're not like freshmen with adjustment disorders because mom never taught them how to do laundry, They've never cooked for themselves kind of situations like you see with freshmen, because I used to work in a counseling center at a university, and 90% of the people that I saw there were freshmen, and most of them with their bulldozer/helicopter parents that never taught them how to do laundry, never taught them how to cook, never taught them how to take care of themselves, never taught them how to clean, never taught them how to do anything, and now they're away at college, and all of these things are happening, and there's nobody there to do it for them, and that's their stressor. That's not our students.
That's not our
students
group,
are
no.
adults. They've got a whole other set of problems that are way worse. So, relationships, everything you can imagine. I've heard them all, and I intentionally make them understand the fact that you can talk to me about anything, and I'm not going to judge you. And I think that helps a lot. And I think that as faculty, that's something that we really need to work on. Our students shouldn't be afraid of us.
No, absolutely not.
So, but by that same token, you draw the line too. There's a line.
Sure.
And that's the one thing that I've always prided myself on, is the fact that I've actually had students say, "Ooh, I just crossed the line, didn't I?" A little bit. Yes, yeah, a little bit. There's definitely a line there. Boundaries are important. They're very important. But that being said, talk to me about anything, and I'm listening. And if you want advice, I'll tell you what I think. If not, I'll just sit here and listen.
What comes to mind for me right now as well is that there's a component of resilience that is flexibility. And to model that, we have to sometimes be flexible with, implementation and so forth. But there's a line. There's only but so flexible that we can be. We do still have to maintain standards for, progression, et cetera. So I think, just explaining to them where we can be flexible, where we cannot be flexible, and, why that's important.
And you can be firm, but you can also be available and listen, One of my favorite expressions that I use sometimes especially with junior faculty, is not every situation is a nail and not every solution is a hammer. And so think about it, especially if you're making decisions or writing. I've seen places that write these very rigid policies, and you say to yourself, is that policy really going to work for every possible situation that you can imagine?
Or did you just paint yourself into a box that you're not going to be
Right.
able to get out of?
Right.
Yeah.
And then I also say, if it's not okay for your boss to do that to you, why is it okay for you to do that to them? And so, like, for example, my bereavement leave policy when I was a program director was, you go take care of what you need to take care of. I don't want you in the operating room on the day of your grandmother's funeral who raised you. Where's your head at? It's not fair to that patient that you're taking care of because your head's not in the game. I tell them, go take care of what you need to take care of. Once you're done and you're resolved and you're ready, you come back and we'll figure it out, right? I don't need this 3-day first-degree relative, 2-day, second-degree relative brief. Because if that wouldn't work for you, why does it work for them? It doesn't, right? So having that flexibility and that ability to be able to help them to, you're kind of giving them the tools they need to fix their own problems that way. And they're not going to take advantage of that. I've never had one take advantage of it. I've had them go do what they need to do and come back, and we figured out the makeup, what we're going to do. Now, the part of the firm and the rigid part is that you're going to make the days up. And so I tell them that up front, the longer you're gone, you're going to have to make these days up, whether it be over a break or whether it be whatever. But, offering them that grace and that adaptability, like I said, not every situation is a nail and not every solution is a hammer.
Fantastic example of where flexibility is important and where we can be flexible and, where the boundaries lie, and that we have to be humans. We can't tell them, go out there and be great, caring professionals and give this exceptional care, and then we're so rigid that we're not being compassionate human beings. That is what we are as nurse anesthetists. We're compassionate human beings.
One of my speeches that I give them at the very beginning is that for any profession to have great value to society is that they have to bring something to the table that's unique and different. And to me, having been a nurse and doing bedside nursing is that, and the ICU experience and dealing with families and being able to talk to people. I remind them all the time, if you remember when you were in nursing school, that first time you had to go do some sort of a interpersonal relationship paper or something, you had to go and talk to your patient, for how awkward that was, right? And how you didn't know what to say, and you were just kind of futzing around trying to figure out what we're going to now, right? We have that ability to communicate with people. We take care of people when they're at their worst point of their life. I've got 5 minutes to maybe 10 minutes at the most to have them. I might not be the best CRNA in the world, but by the time I'm done talking to them, they don't want anybody else taking care of them. And that's the one thing that I think that we bring to the table. So I said, it's valuable. The nursing piece of this is valuable and brings a lot to it. And, you learn a lot of adaptability, and I think you get a lot of OJT resilience training as an ICU nurse that I think you can bring forward to the program as well.
Completely agree. And I think that's a fantastic way for us to wrap this up. I can't thank you enough for being with us today, for talking with us about your work in the area of resilience. I think it's an important domain that all of us recognize as educators is something that we really need to continue to strive to do better on and promote that in ourselves and in our learners. So thank you, Jerry, for being with us today.
Thank you so much. And we'll be anxious to see your survey and pass it on and wish you the best in the work that will benefit all of us in this profession greatly.
I'm hoping to have results probably in less than a year.
Fabulous.
And then I'll plan on disseminating and talking about it, because I think that it's going to be I think it'll be a little eye-opening. So
it'd be great.
So stay tuned. So that's my shameless plug for when you get my email, don't ignore it.
It's fabulous. No, it's important. It's very important work. Very anxious to see where it lands.
Couldn't agree more. All right. With that, thank you guys for joining us, and we'll see you on the next episode of Airway Exchange.